Hello there, I'm Ted Taylor, and I have glioblastoma multiforme known as GBM. I know how devastating it is to hear this news firsthand, and I relate to you. So I make videos about GBM and what I have learned to share with you and your loved ones. I do not have any official or formal medical training, dietary training, or any other medical professional designation. These videos do not provide medical advice and are intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Join me on this journey and we'll walk this path together. And we had done our prayers, hugs, and kisses before she took them home. I gave my 3 kids a special talk, lots of hugs, kisses, tears, and prayer, and said goodbye as they left for the night before my surgery. The morning of the surgery, I said goodbye to my dad and brother as I was being wheeled down the corridor towards the operating room. They told me some friends were keeping a vigil and would be waiting outside. We said a prayer, and I was whisked away into the operating room. There were at least 4 or 5 people in the OR, and they wheeled me up to the operating table. I slid across onto the narrow operating table, and the anesthesiologist explained what was going to happen to me to put me out for the surgery, and that he would be there to monitor the situation. My surgeon asked if I had any questions, and then asked me to count in my head. I began a final prayer before the procedure, and I do not remember if I completed it. I woke up in the neurosurgery post-operative room where I had a nurse beside me continuously. They asked some questions, and although I was groggy, I seemed to be able to think and move, which was an answer to my prayers. After several hours, I was able to see my dad and ask how the surgery went. I was told that they were able to remove all the tumor they could see, which was great news. My dad and brother were keeping my family and friends up to date, and everyone was relieved that I had made it through the surgery. I was in the hospital overnight, and the first night was not pleasant. I was in a room with 4 other people that included some troubled souls. One of the nurses checking on me tried to give me morphine over and over again that I did not want, as the Advil and Tylenol were working fine. The next day, I heard the neurosurgeon come in and speak to each of the other patients in the room. He let them know their surgery had gone well and that they would be on the mend. When it was my time, he came into my curtain area to tell me the bad news. It was definitely glioblastoma multiforme. And although the surgery went very well and they were able to remove all of the tumor they could see, it is a terrible diagnosis. I asked how long I had. He said with treatment, including radiation and chemotherapy, I would have about a year of median survival. As a single dad, this news was devastating. I would miss my kids' life stages and accomplishments, from high school graduation, university or college, their weddings, and any grandkids. I would not be there to help them in life, and I felt I was failing them. I remember tears at this point. I asked if there was anything else I could do. There were maybe a few clinical trials, but there was nothing that had good possibilities. As he walked away, I knew I had to do all I could to fight this disease, so I could be there for my kids, family, and friends. I would be able to go home as long as I could get a few things accomplished. I had to be able to go for a short walk on my own. I had to get cleaned up and dressed and go to the bathroom on my own. Shortly after seeing the doctor, my family came to the hospital to see me and take me home. When I arrived home, I would be sleeping with a family member right beside me every night to ensure I was okay and there were no effects from the surgery that the hospital had asked us to watch. I began researching immediately. I was searching for everything I could find about GBM and what the next steps were. The next day, which was one day after being released from the hospital, my brother Jamie had asked a friend of his to come by and speak to us about the keto diet as a possible option to help with cancer. His name is Kevin Dornan, and he made time for us immediately to get me started on the keto diet, for which I am very grateful. His dad, who is a doctor, was battling cancer, and when my brother's friend had looked into keto in great detail over many months, he found that the keto diet may help fight cancer. In their case, it had incredible and unexpected results. I began to follow the diet the next day. In hindsight, I was doing the diet I am on today incorrectly for the first 20 days, but it was a start and it was in the right direction. Part of my miracle in the making. Everyone was looking into different options, and while I had found and was reading the book Keto for Cancer by Miriam Kalamian, others were looking at alternatives. You should watch my episode on Keto for Cancer. A link to the book is on my website under Recommended Products. My son found a possible treatment option that looked the most promising of all the options we had found to date, and we began the process of looking into this possibility. It was called Gama Knife by Dr. Duma. Part of this process entailed going back to the hospital where I had my surgery to pick up 2 CDs with MRI scans on them. One had the pre-operation and the other had the post-operation MRI. We left almost immediately for the hospital, which was about 40 minutes away. While we were waiting to be helped to get the CDs with the MRI scans, we turned and faced away from the nursing station, and the elevator doors opened. My surgeon happened to walk out of the doors, and we waved to him. He came over and asked us what we were doing there. We explained the possible treatment, and he said, "Do not go down that road." We said there really aren't any options, and what did he suggest? He suggested an oncologist who thinks outside the box. We took the name of the oncologist, picked up the discs of the scans, and made our way out of the hospital. This is a huge hospital, and the odds of bumping into my surgeon at the exact instant we were there was incredible. In fact, only a few months later, they had constructed a wall in that exact area that would have blocked us from seeing my surgeon from our vantage point. Another part of my miracle in the making. Through a lot of tenacity and out of an abundance of grace, we were able to meet with the outside-the-box oncologist and discuss my situation. His name is Dr. Klimo. He is an incredible doctor and has been such an important part of my journey. Although there were no known treatments, we would look for anything that may help. And having someone on our team that goes beyond the standard of care treatments was key. This incredible oncologist had come out of retirement to help his patients, and he had agreed to take me on as a patient. This is another part of my miracle in the making. We mentioned a couple of the potential therapies we had researched to date to the outside-the-box oncologist, and he looked into each of them and gave us feedback on the results of his research. One option was Dr. Duma and the Gama Knife, which targeted the white pathways to potentially hinder or stop the growth of GBM. Another was a novel but brand new technique being used in prostate cancer treatment called actinium-225. Ultimately, we had to decide about the Gama Knife option, as if we proceeded with that option, I would not be able to follow the standard of care radiation treatment. We elected to follow the standard of care radiation treatment. The actinium-225 potential was not available, and it was not for GBM, although it does look like a possible treatment for some cancers in the future. We were not going to leave any stone unturned. My research had indicated that we should find out if I was MGMT methylated or not. This is a leading indicator of GBM survival. We asked for a copy of the pathology report and picked it up. It said that I was MGMT methylated. Please watch the episode on MGMT methylation for more information about this. All my research on the Keto for Cancer diet had cleared up some of the questions I had about the diet and how to get it into practice. I had a video call with Miriam Kalamian to go over what I was doing and the questions I had for her. She was extremely helpful, and we made some adjustments and set up my chronometer app properly together. I suggest you watch my Keto for Cancer episodes and download Chronometer. For ease, I have this on my website under recommended products. If you would like the free Chronometer app, that is great and it works well. During the month of November 2018, when I was recovering from the surgery, watch my episode on debulking to learn more about the surgery process and recovery. I continued to do research every day and spend time with my family. One afternoon, I sat down to take a rare break. It was on November 26, 2018. I sat down in my chair, turned on the TV, and the last channel that had been watched came on, and it was in the middle of the afternoon news. The news story came up on the screen, and the announcer said a new cancer drug had just been approved by the FDA. It was called Vitrakvi, or Larotrectinib. They talked about it very briefly, and then the screen started scrolling with the various cancers that the drug could potentially be effective on. To my amazement, Glioblastoma Multiforme was listed. I hit record on the PVR, rewound the program, and watched it again. There had never been a drug that could potentially treat GBM, and here it was, listed in front of me. If I had sat down a few seconds later, I never would have heard about it. If the TV had been on a different channel, I never would have seen it. This goes beyond random luck, and I consider this to be divine intervention, a true blessing, and part of my miracle in the making. I dove into this potential immediately and found that there was only a 1% chance that I would test positive to potentially go on this drug. It requires that you are either NTRK 1, 2, or 3, also known as NTRK A, B, or C. They genetically test your tumor, and if it is NTRK 1, 2, or 3, then you may be able to take the drug. I told my family and presented the drug to my oncologist. None of them had heard of the drug. One of them informed me about Foundation 1 for testing, but it would be expensive. My outside-the-box oncologist, Dr. Klimo, said he would look into it right away. He initiated some local genetic testing that was unfortunately inconclusive, so he arranged for a second genetic test to get underway. At various oncology appointments, I would undergo some Karnofsky performance scale tests. These tests help doctors to determine on a scale how well you are doing physically and mentally, and as another possible way to determine if the cancer is returning.